Disadvantages of home mechanical ventilation: it includes problems related to equipment, reimbursement, caregiver stress and fatigue, and the patient's complex needs. Ventilated patients are usually dependent, requiring extensive nursing care, at least initially. Disposable products may not be reimbursable. Financial resources must be carefully assessed when arranging home mechanical ventilation. Schedule a meeting with the interprofessional care team, like social worker, home health care nurse, respiratory therapist, before starting a discharge teaching plan. Another disadvantage of home mechanical ventilation is its potential impact on the family. Caregivers may seem enthusiastic about caring for their loved one in the home but may be motivated by numerous, complex factors. They may not understand the sacrifices they may have to make financially and in personal time and commitment. Encourage caregivers to consider respite care to periodically relieve their stress and fatigue.